Hello students, I am Satwanti Kapoor from Anthropology Department, University of Delhi. So today the topic on which I am going to speak is on the module Demographic Techniques, and it comes from the paper Demographic Anthropology. Now the learning objectives of these modules are to know about the demographic perspectives, to know about various methods about measures of fertility, to know about various methods about measures of mortality, to know about changes and components of population growth. Now to introduce the module, demography is the scientific study of human population, including its size, distribution, composition, and the factors that determine changes in the size, distribution, and composition of the same. From this definition, we can say that demography focuses on few aspects of human populations: size, distribution, composition, population dynamics, and socio-economic determinant of and consequences of population change. Now, population size is simply the number of persons in a given area at a given time. Now, population distribution refers to the way the population is dispersed in geographical space at a given time. Now, population composition refers to the number of persons with age, sex, and other demographic categories. The scope of the demographic category appropriate for the demographic study is subject to debate. The age, sex, race, year of birth, and place of birth are demographic characteristics. These are all characteristics that do not essentially change in the lifetime of an individual or change in a perfectly predictable way. They are so-called ascribed characteristics. Many other characteristics also are recognized as within the purview of the demographer. These fall into a long list of social and economic characteristics, including nativity, ethnicity, ancestry, religion, citizenship, marital status, household characteristics, living arrangement, educational level, school enrollment, labor force status, income, and wealth. Now, most of these characteristics can change in the lifetime of the individual. They are so-called achieved characteristics. Now, in a more inclusive definition, the addition of marriage and divorce as processes affecting birth, household formation, and household dissolution, and the role of sickness or morbidity as a process affecting mortality. Now, beyond these demographic factors of change, there are a host of social and economic characteristics that represent causes and consequences of change in the basic demographic characteristics and the basic component of change, etc. Now, study of these topics defines the subjects of social and economic demography. Now, demographic measurement tools and technique. The major demographic process of fertility, mortality, and migration constitute the basic components to determine the size, composition, and distribution of a population, which require basic tools and techniques of measurement. Now, tools of measurement. The tools of measurements include ratios, proportions, rates. Now, we'll talk about ratios. Now, ratio is a quotient of any two demographic quantities. It is the result of dividing one quantity by the other. Now, ratio quantifies the magnitude of one occurrence or condition in relation to another. For example, sex ratio. What is sex ratio? It is male-female ratio in a particular population. Now, doctor to population ratio, number of doctors in relation to number of population. Dependency ratio, which denotes people who are under 15 years or people who are 65 years and above. Now, we have proportions. A proportion is a ratio which indicates the relation in magnitude of a part of the whole. The numerator is always included in the denominator. A proportion is usually expressed as a percentage. Now, you can see the example on the screen in front of you. We'll just discuss next part. So, these are the ratios. Now we'll talk about rates. A rate measures the occurrence of some particular event, example death, in a population during a given time frame or time period. It is a statement of the risk of developing a condition. It indicates the change in some event that takes place in a population over a period of time. It is defined per unit of time. Now you can see how do we calculate the rate. Like we need vital events and population at risk, and we have given some good examples for you to understand and practice. Now a rate is a ratio or a proportion in which the numerator is a part of the denominator. All rates are ratios, but all ratios are not rates. Now we'll discuss technique of demographic measurement. A change in the overall size of a population is the result of three cumulative changes in the number of births, deaths and migration. Since birth and death occur continuously, and since people frequently change their place of residence, they are the basis of demographic analysis. Depending on their direction and magnitude, these processes are important for social and economic planning in assessing the present needs and the needs of the future. Expansion of socio-economic infrastructure in a given particular area. The technique for measuring fertility, mortality and migration are described below. Now, measure of fertility. Fertility is the reproductive performance of an individual, a couple, a group or a population. It is meant the actual bearing of children. Some demographers prefer to use natality in place of fertility. Now, fertility leads to increase of population. It differs from fecundity, which is defined as the physiological capability of a woman to reproduce. So actually the faculty of women to reproduce is fecundity, and how many times a woman produces a live birth is fertility. Now the most important measure of fertility includes crude birth rate. The crude birth rate indicates the number of live births, children born alive per thousand mid-year population in a given area. On your screen you can see how do we calculate the crude birth rate or CBR. Fertility may be grossly determined as high, medium or low based on crude birth rate values. High fertility rates are more than 30 per thousand, median fertility rates are 20 to 30 per thousand, low fertility rate are less than 20 per thousand. Now we'll come to general fertility rate, GFR. The general fertility rate is the number of live births per thousand female aged 15 to 49 years, the fertile age group in a given year. The GFR is more sensitive measure of fertility than the crude birth rate since it refers to the age and sex group capable of giving birth, females 15 to 49 years of age. It eliminates distortions that might arise due to different age and sex distribution among the total population. The major limitation of GFR is that not all women in the denominator are exposed to the risk of childbirth. Now, how do we calculate GFR? The formula is given on your screen. You can practice with the given data. Now, this GFR is approximately 4 times the crude birth rate. Now, next is age-specific fertility rate, ASFR. The age-specific fertility rate is defined as the number of children born alive to females in a specific age group per thousand females in that specific age group. For example, 15 to 19, 20 to 24, 45 to 49 years of age, etc. Now, the formula to calculate ASFR is given in front of you. The next rate with respect to fertility is total fertility rate or TFR. The total fertility rate is the average number of children that would be born to a woman throughout her life or her childbearing age 15 to 49 years if she were to pass through all her childbearing years at the same rate as the woman now in each age group. The TFR sums up in a single number the age-specific fertility rate of all women at a given point in time. In 5-year age group are used, the sum of the rate is multiplied by 5. This measure gives the approximate magnitude of completed family size. The TFR is one of the most useful indicator of fertility because it gives the best picture of how many children women are having currently. Now the formula for TFR, as you can see, is given there. You can go through this formula, note it down and have a data and kindly practice on that so that you will be able to know the difference between different rates. Now next is gross reproduction rate, GRR. The gross reproduction rate is the average number of daughters that would be born to a woman throughout her lifetime or childbearing age, which is 15 to 49 years. If she were to pass through all her childbearing age, this rate is like TFR, except that counts only daughters and literally measures reproduction, a woman reproducing herself by having a daughter. Now the formula for GFR is given on the screen. Next is child-woman ratio, CWR. Now child-woman ratio is defined as the number of children 0 to 4 years of age per 1,000 women of childbearing age, which is 15 to 49 years. This ratio is used where birth registration statistics do not exist or are inadequate. It is estimated through data derived from censuses, like secondary sources. You don't go and count the numbers actually, you just take out from the registers. Now the next measure of we'll discuss is measure of mortality. Now mortality refers to death that occur within a population and causes reduction of population. The incidence of death can reveal much about the living standard of and health status of a population and the availability of health services. A population group exposed to the risk of death, denominator, the number of deaths occurring in that population group, numerator, a time period. They all are required to calculate death rates. Now there are various measures of mortality rates which include mortality rates, which has three essential elements. One is crude death rate or crude mortality rate, CDR. The crude death rate is the number of deaths per 1,000 population in a given area. Now as you yourself can see that CDR is not a sensitive measure of health status of a population. It is affected by particularly the age structure of the population. Next is age specific death rate or age specific mortality rate. Now death rate can be calculated for specific age groups in order to compare mortality at different ages. As the formula says, it requires number of deaths in a specific age group multiplied by 100. You can see the formula. The next is infant mortality rate or IMR. Infant mortality rate is the number of deaths of infants under 1 year of age, 0 to 1 year or 0 to 12 months per 1,000 live births in a given year. Now infant or children under 1 year of age are at highest risk of death than any other age group, and this is the formula to calculate IMR or infant mortality rate. Now the infant mortality rate is considered to be a sensitive indicator of the health status of a community or a population because it reflects the socio-economic condition of that population in question, that is the level of education, environment, sanitation, adequate and safe drinking water supply, communicable disease control, provision of health services, etc. These factors mostly affect infant and children under 5 years of age. Hence, IMR or infant mortality rate widely varies between countries in the world. Next is child mortality rate, CMR. It is the number of deaths of children 1 to 4 years of age per 1,000 children of 1 to 4 years of age. It is a sensitive indicator of the health status of a community. As the formula is reflected on the screen, you can please note it down and practice yourself. Next is under 5 mortality rate. It is the number of deaths of children under 5 years of age in a year per 1,000 children under 5 years of age. It is also a very good indicator of the health status of a community. It can also be calculated as the number of deaths of children under 5 years of age in a year per 1,000 live births. Now next to be mentioned is neonatal mortality rate, NNMR. Neonatal period is the first month of age of an infant. Neonatal mortality is the death of infants under 1 month, less than 0 to 4 weeks per 1000 live births. Now, neonatal mortality rate is calculated as you can see on the screen. Mortality of neonates reflects mortality due to maternal factors during pregnancy, birth injuries, neonatal infections, etc. It is an indicator of the level of prenatal and obstetric component of maternal and child health care. Next is post-neonatal mortality rate. The post-neonatal age is the period of time between 1 month up to 1 year. Post-neonatal mortality rate is death of infants 1 month of age up to 1 year, 1 to 11 months of age per 1000 live births. As per the formula, you can calculate the rate. Now, the post-neonatal mortality rate reflects the death due to factors like environmental sanitation, infections, communicable disease, etc., nutritional problems, child care lack, etc. It can be used as an indicator to evaluate maternal and child health, care services and socio-economic development of a community or country. Next is maternal mortality rate, MMR. Now, maternal mortality rate is the number of maternal deaths related to pregnancy, childbirth and postnatal complications per 1000 live births. Usually it is per 1 lakh live births. This MMR reflects number of deaths of women related to pregnancy, childbirth and postnatal in a year into 1000 number of live births in the same year. It is a very sensitive indicator of health status of a population. It reflects the socio-economic status of a community. The maternal mortality rate of Ethiopia is estimated to be more than 850 deaths per 1 lakh live births annually. This is among the highest in the world. Sex-specific death rate is the number of deaths among a specific sex group, male or a female, per 1000 population of the same sex group. Now, sex-specific mortality rate is used to determine which sex group is at higher risk of death than the other. Now, to summarize this very interesting module, demography is the scientific study of human population, including its size, distribution, composition, and the factors that determine change in the size, distribution, and composition of the same. Number of persons in a given area at a given time. Now, population distribution refers to the way the population is dispersed in a geographical space at a given time. Now, population composition refers to the number of persons in age, sex, and other demographic categories. Demographers describe change in population, size, distribution, and composition. They make use of these patterns in studying population trends, developing theories of population change, and analyzing the causes and consequences of population trends. Now, various demographic measures such as ratios, percentages, rates, and averages may be derived from such data. The resulting demographic data can then be used to describe the distribution of the population in space, its degree of concentration or dispersion. The fluctuations in the rates of growth and its movement from one area to another, etc. can also be measured. A change in the overall size of a population is the result of 3 cumulative changes in the number of births, deaths, and migrants. Since birth and death occurs continuously and since people frequently change their place of residence, they are the basis of demographic analysis. Now, depending on their direction and magnitude, these processes are important for social and economic planning in assessing the present need and needs of the future expansion of socio-economic infrastructure. There are techniques for measuring fertility, mortality, and migration in a population which are used to depict the picture of the population. Now, the major demographic processes of fertility, mortality, and migration constitute the basic component to determine its size, composition, and distribution, which require basic tools and techniques of measurement. Now, the tools of measurements are ratios, proportions, and rates. To a large degree, the knowledge is captured in the demographic perspective. It provides demographers with a framework within which data, models and theory can be used to explain how population work, how population size varies. Thank you very much.